You know, it used to be in the United States, you couldn't get a breast implant approved if you had a presidential pardon, but in the past couple of years, we've had like hundreds of breast implants approved, and just last week, Allergan reported that they had their Soft Touch Inspira line of breast implants approved by the Food and Drug Administration. Jason, what does this mean for patients?
So let's just clarify this a little bit. So we've been using Inspira 1s for about a year now, right? And then they had approved Inspira 3s, which had the gel that was in the form stable implant. So this is now an Inspira 2 that's approved, that's somewhere between the two. I think it's great. It's more choices for us. It's more choices for the patient. And I think that perhaps this will be for the patients that, you know, was rippling with some of the other implants, and now they didn't really want as hard an implant as the form stable implant. So I think this is something as an intermediate implant for all of us.
So Dan, what do you think?
There's no implant that's going to save you from a badly done and badly planned operation. And I think that for patients, they need to understand that it is not the implant that is going to get you the result. It's the surgeon. And you could probably get a better result, Bill, with smooth round gel implants 100% of the time against any other surgeon who's using textured or any other high-tech device. Because at the end of the day, it's about the surgical technique.
Do you feel like it's just more choices, or do you really think it's going to be something that's going to develop and the implant people will tend to use more?
It's a little bit of both. I think the more options, the better. I like having a lot of options at my fingertips as opposed to when I came out of residency and it was smooth, round saline implants, period. So I do like having more options available, but at the same time, I have to agree with Dan. It's more about the surgeon that you choose and technique than the particular implant. You're not going to get a slam dunk result just because you chose one over another. But when you really refine your techniques, I think probably, as you guys can attest to, when you are looking at revision surgery and maybe someone who presents with a lot of rippling with a particular type of implant, sometimes you can change that and use a different kind without having to do much more fat grafting or something else and get a different result.
Yeah, I think it's those are all really good comments, and I do think that, you know, we always talk about tissue-based planning and using measurements and other things to select the implant that fits the breast, but you know, this may add one additional characteristic that we'll customize for any individual patient to give them a better result. But I think it's a good thing to have the choices, and I agree with everything you guys said.